Hello, good morning. I'm Ellen May Florida, a registered pharmacist, 26 years old. I'm currently working in a private hospital here in Santa Cruz, Davao del Sur. So I have a question here. How do pharmacists communicate with patients whenever they dispense drugs? So, in my 6 years of experience being a pharmacist, I have worked in a community setting and for 3 years, and then here in the hospital also for 3 years. So there are differences in accommodating patients in that different setup of a pharmacy. So in a community setting or in a drugstore, patients can go directly to the pharmacist or drugstore, then ask directly the pharmacist what medicine should they take if they feel something like this or uncomfortable like that. So the pharmacist will have several questions for the patient before dispensing the drugs. For example, how she feels or what are the symptoms that the patient felt, the severity of the, for example, the pain, like that, or how long does the patient suffered that symptoms, or if the patient takes other medication to prevent drug-drug interaction, or if the patient have allergies, if they have already a maintenance drugs, or if the patient will have these symptoms for a very long time and then taken a drug but it doesn't ease the symptoms or decreases the level of it. So the pharmacist should advise to the patient to go to the doctor if symptoms persist. So how do pharmacists counsel the patients? So of course, whenever it's not just the pharmacist will the patient will buy a drug in the drugstore and then the pharmacist or the sales lady will give the medicine, but the proper step by that for that is that the pharmacist should explain to the patient, for example, it is an RX medication or the patient has a prescription. So the pharmacist will explain to the patient how does this drug works on you, or what is that drug used for, what is the proper dose in taking that drug. So whether it is taken during, like for example, taken during after meal or before meal or morning or in the evening, like that. So second thing is the proper storage of medicine, like you should not put the medicine direct to sunlight, or you should store it in the fridge, below the fridge, or whenever you are you're letting your child or a pedia take a drug or a suspension, you should shake it very well. Or the importance also of compliance in medication, especially in antibiotics, like that. So you should give importance or emphasize it to the patient that he should or comply this medication if especially if it is maintenance drug, or if it is an antibiotic, they should take it for 7 days straight. And then, for example, also in the storage of medicine, so you should advise to the patient that if the drug is being used or stored in the fridge for a very long time, like for a span of 1 month or so. So you should disregard it. And check also the expiry date, like that. So what else? So I think that's it. Thank you so much.